So this talk is actually more of a concept that's being applied mostly on the coast that we've been trying to push in front of our clients for some time. This is not a talk full of case studies of our own clients. This is a talk about ideas and how to apply them to your organization and how it could work for you, and how capturing the minds and making those connections like Liz talked about with women can give you a better competitive position, but better yet, enable you to fulfill your mission to help more women and their families improve their health care. So I'm going to go ahead and let Susan take over here, and we're going to kind of tag team. Susan?
So Molly already gave me an introduction, so you've learned a little bit about me. But when Randy brought up the topic of this discussion and asked if I wanted to be a part of it, I was really excited to be able to talk about this. I think there is a huge gap right now and a definite need that could be filled through concierge services targeted specifically to us, to the women. A little bit of, and why I'm behind it is because I feel like I'm a primary consumer of it. And if healthcare services in our local area started offering something similar to kind of what we're going to talk about today, I would be the first to jump on board and say, yes, please, I need the help. So a little bit about me. Clearly I'm a woman, so I fit the target market there. I'm also in my mid-40s. And I don't know what happens after you turn 40, but things start changing and breaking and not working the way that they used to. And quite honestly, in the last few years, I've seen my doctor more than I probably have in the last 10 or 15. So that's an immediate need. On top of that, I have a career that's pretty demanding. So a lot of time spent work within the work confined hours and also outside the work confined hours. I'm a wife with a husband that also has a really demanding career. And so it's hard for him to help, with various household things. I'm a mom to a very active teenage son who feels like he needs to be involved in absolutely everything. And some of that stuff is athletic related, and along come the injuries. So, and the other hat that I wear is I'm a daughter to an aging parent. And my mom passed away a few years ago. So that's left me in charge of helping manage my dad's health care. He's in his mid-80s. He's dealing with prostate cancer, COPD, congestive heart failure, failing eyesight. I know it all sounds pretty bad. I mean, he's doing really well. But at the same time, it's a lot of doctor's appointments. It's a lot of having to stay on top of what's going on in his life and making sure that he's getting the proper care he needs. So, yes, I would be a primary target market here. So as we started to put this presentation together, we have some really great women that are in our office. So we all got together and we said, what are our days like? What are we challenged with? What do we need help with? And scheduling healthcare items and working through different healthcare pieces was a clear one. So we started to put together what our days look like. And I have a feeling you guys are probably going to notice some of this and feel some similarities. It starts off pretty slow, but essentially we hit the ground running. And we've got one overachiever that decides to run in the mornings too, which is not me. But as your morning picks up, so do all the responsibilities and all of the hecticness of your daily requirements for work, and your home life still keeps on getting interspersed in, and you start to see these colored items on the screen representing different healthcare things that need to be taken care of, whether you're scheduling stuff for your kids or your dad or your parents, and you're just go, 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 and at the end of the day, you lay down and you go, what did I not get done? And you think, well, I got stuff done for this person, and this person, and maybe I didn't get stuff done for myself. I know that's me. I put myself at the end. So we're hoping that through our discussion today, we can kind of talk about how this concept of concierge can be applied more to our local rural areas and start to give women the tools and the needs of being able to manage their life and their families better. So we'll talk about, the female's healthcare expectations, exploring what this new product line could be, and then how that inversely positively affects your organization. So I'll turn it back over to Randy.
So let's talk a little bit about the current state of U.S. hospitals and why this is important. So right now, 50% of U.S. hospitals are operating at a deficit. 50%. So that's a pretty startling number. And I think a big part of that is that everything's aimed at the average patient. Insurance is also aimed at the average patient and the average risk. It all relates to insurance. That's a whole nother talk I'd like to give. But we don't have time for that today. We don't want to talk about insurance. But this one-size-fits-all approach doesn't really do a lot for patients, okay? So when you look at even quotes from the New England Journal of Medicine, like this one I have on the screen, precision medicine, on the other hand, is an innovative approach that takes into account individual differences in people's genes, environments, and lifestyles. This is where things are headed in healthcare. But we're not there. We're a long way from there. When you look at the culture shift that's got to take place to consumer engagement. So you have affordability and coverage gaps. We all know that. We have rising out-of-pocket expenses. They're driving people to choose lower-cost options sometimes when they shouldn't. We have that holistic focus, though, that's starting to take root, which is good. So we're looking beyond traditional care to look at more determinants of health status. We're integrating nutrition better all the time, education, exercise. A lot of this is already all there, okay? A lot of the hospitals and health systems in this state are doing a lot of this, but it's not necessarily packaged, and it's certainly not really communicated well enough in some cases. We also look at payment for value. So as with the ACA, reimbursement based on outcomes and quality measures is huge. So that's a big reason why we've been pushing this kind of concept to a lot of our clients, is you've got to look at delivering value. New technology plays a role. Chronic disease management, of course, is huge. How do we get more involved with women to directly impact their health as well as the health of their families when it comes to diabetes, asthma, and other types of diseases. And then again, community benefit. So we all know we have to be able to report community benefit. It should be more than stats. It should be real outcomes. So how do we better manage our population to assess duplicate care, service gaps? How do we make our system work better and smarter for patients?
Okay, so when we look at marketing to women, statistically, we spend a lot. We spend a lot more than men do. Inpatient expenses and home health expenses were, on average, $20 billion higher. Why is that? Well, we talk, we research, we want to know, we want to get educated. So 64 million of us are regularly sharing advice. That's kind of shocking, right? We're all talking and comparing and giving our opinions on this stuff. But 25 million of us are then online further putting that out there. And overwhelmingly, nearly all of us are asking for advice from others. Who do you use? How did this work for you? It's not uncommon when you log on to Facebook now and you see somebody post seeking recommendations. I've got a lot of younger friends that are new parents or that are pregnant, and they're looking for their pediatricians. Why are you using this pediatrician? Why do you like them? And the responses you get on that are positive and negative. So when we look at the ones that are positive, whether it's on social media or not, it's a little bit smaller discussion. It's like, yeah, I really like them because of blah, blah. But when you find something that you don't like, thanks to our lovely social media world now, it blows up, right? And it goes across the board. So Michael Dowling, who's president and CEO of North Shore, has been proactive in his thinking as well. And to quote him, he says, we have to get we have to get way, way beyond thinking of women's health as being limited to pregnancy delivery. Women's health is everything. Cutting across a multitude of departments and service lines to be able to put a coherent face and structure around the women's health delivery system. So we're not just the baby makers. We're the decision makers. We're the ones that are managing everything from our own personal health to everybody in our family's personal health. And that's what he's recognizing and seeing that need.
This is North Shore, New Jersey, so not Illinois. Just so you know.
Sorry.
Yeah.
Didn't think about that.
Yeah. Just wanted to clarify in case somebody was wondering who Michael Downing was.
Yeah. So, how does that come to you guys? We're in a really unique situation at this point where hospitals have this great opportunity to come up with a solution for continuum care that addresses our personal needs as a woman throughout our life cycle, but also putting something in place that helps address all of our family needs as well. And statistically looking at this, and it kind of ties back into what we were just talking about, 80% of us are making the healthcare decisions for ourselves and our families. And half of us are women. And sadly, over half of us are pretty frustrated and feel like the healthcare system as it's set up right now really doesn't get us and doesn't fit the needs of what we're looking for. So how do we get to that point? The biggest piece of it is whatever solution is put in place has to come from a place of developing trust. And the best way to start doing that is through consistency, being rigorous, and being forward, continuous thinkers, not being reactive and waiting to see a consistent problem happening over and over again, but anticipating what these new requirements are going to be and getting ahead of them. And then being involved in the groups of where the women that are using your services are, showing that you are more than just a place where you walk in and you see them in one specific area, but getting back involved in the different community areas. So to kind of wrap up a little bit of this section, just to reiterate, typically we as women care about the connections, the sharing of the stories and getting that information, the communication, and most importantly, the candor. We don't want to be sold on a gimmick. We want actual solutions. And that's what we're hoping that a concept of this concierge care that's really targeted to a woman's needs can actually provide.
All right. So how do we build this thing, right? So a lot of you already have a lot of the components, okay? But how well is it packaged? How well is your women's healthcare product line, including some family care, truly packaged together? Well, one of the first things you have to do before you even step into this, we can't introduce any concierge components if we don't have an actual product line that works. We also can't really introduce an effective product line if we don't have the right physicians driving it. So the first step's got to be discovering the need for specialized physicians and procedures. We got to see what do you have, what are the gaps. Of course, research can play a key role in that. Recruiting and partnering with new and existing physicians. So in those areas like cardiology, dermatology, ENT, endocrinology, and so forth. And then furthermore, really break this down, and this is kind of a new continuum that I discovered, is breaking it down from adolescents, Gen X, baby boomers, and seniors. Okay, so actually recognizing adolescents in the continuum. Okay, and then looking at seniors is very, very important at having their own set of services, the way you break this down through life stage, rather so much than just, we're going to focus on women 25 to 54, and that's all we ever care about. We've got to work it through the continuum, because, for example, if you have an adolescent set of services, the mom in the center can be aware of that and start their daughter out the right way. Okay, so that's an example. Or care for her aging mom or dad, knowing that those components are there. Another key attribute you'll notice on this And by the way, we'll have all these slides available on the website, so you'll be able to get all this and this on video. You'll notice that behavioral health is on every one of these bars. So, most significant challenge in this country is behavioral health, right?
I don't know if, is that psychology? Is it, okay.
Yeah, psychology is behavioral health, right? So that drives most of the healthcare choices in a lot of cases, and causes other issues. So I thought that was interesting when I found that too. It's on there every single time, even in the very beginning, at the very end too. Okay. So branding. Now there's a lot of different ways you can go with this. Some hospitals and health systems are doing their own brands. They're building their own hospitals. They're investing in a lot of bricks and mortar. That doesn't always have to be the way this is done. That's really actually not what I'm recommending, is to invest a lot of money. It's a matter of channeling what you have and figuring out a better way to do customer service and communicate these benefits and services with one focused effort. But no matter how you design it, the more energy women sense from that brand, the greater its attraction opportunity to create that future value. And that's what we're talking about. Okay. Great quote from Modern Healthcare. We can keep people out of the emergency room. We can keep them out of the hospital. We can keep them out of the nursing home. We more than pay for ourselves in terms of improved outcomes for the patient. Honestly, we think we're part of the answer to the healthcare issues in the world. Now, that relates to concierge medicine on the coast. That's where I picked that up from California. Now, there was a lot of people paying for concierge medicine, $3,000 a year, $5,000 a year. That's not what I'm talking about. Okay, that's not what we're talking about today. Charging for it. Okay, I'm going to get to how this works in a minute. But this is the root benefit, right? Okay, the more we keep people out of those situations, the greater the value. So here's another example. So this is from Stanford Healthcare, and they are offering one-to-one customized concierge medicine care in different levels. So check out this website. And there's a few hospitals doing this. I've got some more case studies in the very end of this presentation as well that we'll go through. But if you check this out, and I'll just read this quick paragraph just to give you an idea what value they're communicating. So when you join Stanford's concierge medicine program, you're investing in your well-being. You will have a one-to-one customized healthcare program founded on a close relationship you will have with your dedicated doctor, and you'll enjoy a range of conveniences and first-class care to fit your health, work, and lifestyle needs. So that's in essence of a kind of a model that you can follow, but it's not just about having your own personal doctor. It's about a complete service that makes things easier for women to take care of themselves and to take care of their families. And so Susan's going to kind of go through how to package this in a funnel.
Okay, so we talked about Stanford. Stanford clearly isn't the only one. Mayo's doing this. Who else? Duke Health, Boston, Mass. You're seeing it out on the coast. And most likely they are targeting, the higher income patient base. And what Randy was saying, this does not have to be structured in a way where we're trying to target a higher income base for our area. It can be very attainable. And if we look at it more from a funneled aspect, we can chunk it into different areas. So we can look at it from family health, from areas that can be shopped, from items that can be scheduled, and by location. So packaging solutions where it makes it easy to go in one shot and get your school immunizations done and the sports physicals and looking ahead to November and going, I better schedule a flu shot now. And, from my personal perspective, can I go online somewhere and see all these doctor's appointments that my dad has and go, okay, all this is scheduled, and you've got a blood test scheduled here and they've scheduled a blood test. Can we get this together? So starting to help bring that together as well. Shopping services. I don't need to go into all of these details, but you guys have learned a little bit about me already. I'll share a little bit more of my personal story. I'm a well-educated person, and from working in this industry and being involved with clients in the healthcare industry a little bit more aware of the different preventative measures you need to be involved with. Breast care, right? Getting your mammograms every year. Annual exams. My mother actually passed away a couple years ago from breast cancer. So I know the importance of getting my annual mammogram. Last year, guess what I did not do? Missed getting that scheduled. Missed getting my annual scheduled. Not because I didn't know that it was important, but because I was too focused on making sure my family's health needs were being taken care of. So when we look at it from that perspective, there are gaps that we can start to put in place with the services that we're offering to identify, hey, these people have missed. She missed here. How can we recapture that back? So that's what we're talking about, is trying to help, when things get crazy.
Because, the key point is no one called her. No one called her, no one emailed her, no one texted her to say, hey, you missed, you didn't schedule it. We kind of just let people, okay, we can't operate healthcare anymore like a car dealership. That's the way I compare it to. Car dealership salespeople sitting in a room waiting for people to come in, right? They don't come in, I guess they don't make a sale today, right? Healthcare is a little bit like that. We have a tendency to run advertising hoping people show up, when we could do more if we proactively called and contacted people and build connections and with a certain set of families. So we'll get into a little bit how this is set up later, but that's what it's about, okay? Because if you lose people, it really brings it home, okay? So that's the other important part. She's lost somebody. I've lost my dad. I've lost my mother-in-law. I've lost one of my best friends of cancer. You get it, okay? Because you see how the screenings could have prevented and extended those lives. So that's something I really wanted to drive home today, is challenging you to think about, why aren't we calling? Why aren't we reaching out? Why don't we have this set up? Okay, and I'm not saying it's all the same.
Right. Yeah, and there are pods of groups that are doing a little bit more than others, but as a whole, we are falling short. So as you put those packages together, then you got to figure out how you're getting that message out. And a big piece of it is your integrated marketing approach. And we're a digital industry now, so there's a multitude of different ways to get this out, not just by one vehicle. So utilizing your website, doing video testimonials, the email marketing, social media, across the board, whatever you do choose to put in place, you need to come at it from different avenues. This is a fantastic example from Lutheran Medical that just grabs your attention. And quite honestly, when we were putting all this together and looking at this, I was like, what is this? I instantly keyed in on the header with womenology. I identified with the running and everything else, and it drew me in to read the small print. A lot of our ads that we put together, we don't put small print. We want it big and in your face. But what did this do? It drew me in to go, hey, what is this about? I didn't know if it was an article or if it was promoting a service or what. And it's actually talking about breast health. So they did a really good job of just reaching out to their target market. So once you do that, then you've got all of this stuff going on the exterior with your marketing departments and whatnot. But your best first line are the people that are working with your patients on a daily basis. Are they talking to them? Are they getting the feedback? Are they finding out what's frustrating about trying to schedule appointments or working within the system that that group has? Those people will be able to give you much more valid information than statistical data from Google Analytics. And then the consistent contact. And this gets back to kind of what Randy was just talking about. So I missed my appointment last year. Well, why was it on my mind to begin with to even schedule?
Mom died.
My mom died, and I also got that little postcard reminder, right? Like, oh yeah, I got to get this scheduled. Well, I didn't get it scheduled. Do you think I'm going to get a postcard reminder this year? Nope, because I'm not in the system now. So
I think you went somewhere else.
well, and that's
That
the
can be an
question.
assumption.
And having something in place to have that red flag to go, hey, we didn't see her in 3 months. Hey, we didn't see her in 6 months. Let's shoot her an email. Hey, let's get this scheduled. Here's a link to schedule your exam. Still don't do it. Let's call. Why didn't you get this scheduled? What if I were to say, well, actually I did, but I went with somebody else? Well, why'd you go with somebody else? Well, because of blah, blah, blah. Now all of a sudden you're getting really useful information back. And you have the potential to recapture me because now I'm looking going, oh, maybe you guys do care about me. And maybe the issue that made me choose to leave wasn't that big of a deal anymore because you're investing in trying to reach back out to me. So
It kind of comes down to this great quote I heard last week at a different conference, not even related to healthcare. No one remembers normal. That really reflects on kind of what Liz said. So, I mean, I had a conversation with a client yesterday about just trying to come up with ideas to create a more of a really unique experience when it comes to the small hospital, but really any size hospital. You know, we charge more per night than anybody could possibly imagine, right? And we'll go to a hotel down here and spend $400 a night or something and just go, wow, I mean, that's a lot of money. But boy, they just absolutely just swarm you with all this great stuff. The robes in the room, the heated towels and all that. We don't do much of that at all. And we charge what, 10 grand a night or whatever it is? I mean, when you really start thinking about it, it's kind of crazy that we don't go out of our way to make things better and make things not normal. And, you know, whether it's the ice or whatever it is. So that's how that, you know, when we talk about fresh ideas, that's also can relate to the actual service once they get there too. So.
And actually, I'm going to
Yep.
send that back to you.
All right. Okay. So let's kind of dig into this a little bit now. So this is the Women's Health Concierge Service. So how do we get this going? Well, what the concept is specially trained people, women, of course, working with women. And I guess I'm going to challenge you as an audience, and please, you know, we can make this more of a discussion. You can give me examples of what you're doing if some of you are already doing this. But we all know that we have units and we have educators that have extra time during the day. Because I'm not talking only about, you know, applying this to say like a call center, because in a large volume setting, in an urban setting, you'd have to do almost a call center to keep up with the volume. But with community healthcare, smaller communities, you certainly can do this with in-house personnel, like I said, RNs, diabetes educators, people that have additional time that can make these calls and reach outs. And it doesn't all have to be calls. So it's developing a model of your own people that can build relationships with the women in your communities. And when I say relationships, I mean real relationships where people know who these concierge people are, patient care coordinators, whatever you want to call them, but they're very much mixed into the community. People recognize them and they know, you know, she's my resource, right? She's the one that makes things easy for me, and that's why I go to that hospital. You also want to establish that direct line of access to the information. That's one of the problems now. We have phone lines, we have call, you know, we've had nurse on call, we've had all that for a long, long time. But what we don't have is we don't really have a lot of email going on. Now it's getting there with portals. But, you know, direct email from a real person is not going on much in healthcare, or texting. Now, I'm not standing up here to figure out all the legalities of it, but I'm standing up here just trying to say we got to get there. Because if we can get there, it'll make a huge difference. Because, again, we have a tendency to do a lot of push advertising, and that's why we come to these seminars a lot of times, right? We want to figure out how to do digital and be able to push the messages out. But that's all good. That's good communication. But what about the one-to-one communication that we can have with patients? So we want to reduce their stress to win women over, and we want to take the hassle out of their health care. So we got to move the brand. We got to move the organization to do that. So you got to look at operations, you got to look at marketing, we got to look at HR. All three areas have to cooperate in an idea like this. And you got to find your niche. So not every hospital marketing person in this room is from a large integrated health system. Some of you are with community health operations, some of you are with critical access hospitals. So you have real diverse set of group in here right now. I know that from knowing some of you. Okay? So there's different levels of niche. Okay? Some can be as holistic as possible. They can offer absolutely everything from neuro to cardiac to primary care. Others, not so much. So find your niche in the healthcare continuum and then build that product line around it. Integrate co-locations, okay? Looking at all your locations and how that makes things easier for women, and then package of services. Once you've done that, you can market it internally, then externally. HR has to be involved, of course, to introduce that concierge, the idea of a concierge position. And again, I'm using that term as a category term. That really wouldn't what I would suggest calling them, because it can be confusing. Be more like patient care coordinators, not navigators. Navigators are when somebody's already in the hospital and they're being navigated through the system that we put them through, right? This is someone that's going to outreach and almost in a way, you can say it, sell for the hospital. Okay, it's like one-on-one personal help, coordination, like they do in hotels. When you ask, how do I go, which restaurant should I go to? Well, you're doing it proactively. You're calling them and you're moving them through their life cycle to make sure they get the right test, their kids get the right test, everybody gets taken care of, right? So that's what it's about. So introducing a team to do that. But first of all, what I would recommend is you develop a task force to be able to develop this idea. So the task force will be made up of very visionary staff members. So none of those negative people that Liz talked about. Okay, you keep the negative people out, keep the no people out. And I know that's not easy to do. Okay, I really understand that. But you've got to have people that are empowered to make a difference and make concrete decisions. If you don't have a team like that, you don't even need to go down the road. You won't get anywhere with it. You've got to get the right team. You've got to get the CEO to open up the minds, and you've got to get everybody to open up their minds. And then maybe adding a couple visionary women from the primary service area that are not working for the hospital in that group. So a lot of foundations, auxiliaries have women that can be brought in for that kind of input. And then, of course, that group would help formulate the right product mix. And then, of course, how we package it together. So it's about process, it's about human touch, leading to higher patient satisfaction. That's the goal. So the concierge role, again, is to bond with women in the communities that you serve, is determine their needs and speak to them on an ongoing basis. So on a regular basis, when needed. Help them find the right physicians, outpatient services to improve their health and the health of their families, and then set appointments for them. So that's the big wow. So you might have somebody actually call you and say, I'm going to set appointments for you. I know you need this mammogram, but what about Jeremy? And because he hasn't been in to see the pediatrician in a year and a half, and we'll work on this together because I have all your data in front of me, and I know exactly what everybody needs. But you tell me what else you need, and I'll help you. I'll help you navigate the system. I'll take the system out of it. Enable email contact, okay? That's really key. Got to get there. Reduce the stress, make it easier for them to access care that's currently spread all over the place. We also have that issue. We have all these clinics and all this care all over the place, right? The bigger systems are even worse. So how do you get it all together? Well, a lot of them have built women's health care in one hospital, but that's a women's healthcare hospital. We're talking about the whole system here because it's about relationships with women and their families, and not just women. Okay, but it starts with women. That is what creates competitive edge. So you've got to determine what it'll take for your service professionals to be successful. So your service professionals, meaning those people that are actually manning the stations, right? Actually reaching out. So again, developing that single phone number, that email for questions, concern, and help. So beyond the outreach, there's also a number to call in. So you need it both ways. Okay, so that way they can call in when they need advice, and they'll get it as well, because there's no way you're going to just call everybody all day long. It's only gonna be-
He'll be a live person, obviously.
Yeah,
Yep.
exactly. And again, it can be at different levels. A couple examples. This is a really good one. Johns Hopkins is doing this. We all know Johns Hopkins is a major leader in healthcare in the United States. They've been offering new at the time personalized service to help women manage their doctor's appointments. So they're already doing this. It's a good one to study. So it's integrated in the hospital, the outpatient center, the satellite clinics, all of it. They have one single phone call you can make. They can find all the helpful tools they need, and a lot of online content as well. But they have specially trained people that are available to schedule and coordinate appointments. So this is already going on. So here's a couple quotes, both from physicians, one OBGYN, and then also a professor, because of course they're a teaching facility. So women have increasingly complex lives, and we want to make it easy for them to schedule all appointments they may need. As physicians, we are still learning what differentiates women's health. Some diseases, like heart or digestive diseases, may appear differently in women and need to be treated differently. So again, it's that taking the time to build the relationship and recognizing the difference. Another good example, similar service. Some examples, some of the questions they have been tracking at Health East Care System. When should I start prenatal classes? How do I register? How do I schedule a mammogram? Do I need a doctor's referral for an osteoporosis scan? Is there anyone who can help me make healthy lifestyle changes? So they add that peace of mind that staff also has a doctor backing up those nurse triage that are in charge of this program to help with more serious issues. So here's another example of how you could put this in practice, okay? So one of the most significant issues and points of stress for cancer diagnosis with women is getting a "we found something" mammogram call or a note, right? So how do we close the loop and narrow that time between diagnosis and, between scan and diagnosis and discussion? This type of program could play a role in that to squeeze that down. There are other facilities doing this where radiologists, surgeons, and oncologists are working together to reduce that time from months down to weeks instead of having that waiting period. So that's another example, is looking at specific issues that are there that really stress women out and try to solve that problem through a program like this. Susan?
Okay, so swinging back to the communication a little bit, we touched on this slightly earlier. This needs to be involved at a community level. So whatever program you choose to put in place, it needs to infiltrate the different aspects of our worlds across our churches, our work, our friends, families, so people can start talking about it and saying, hey, did you know so-and-so's doing this? Oh my gosh, this made my life so much easier. So it needs to get out through the community. Likewise, you need to utilize your social media channels like we talked about earlier. So getting that new service line out there by brand and getting people and encouraging them to come look at it and comment and discuss. And, and if you get a negative post, that's okay. Have the dialogue with them. Don't shy away from it. The minute you shy away from it, it creates this, I wonder what they're hiding. So get it talking on social media. That is one of the quickest ways to start to get it out there. And get involved in causes. All of our areas have key events that happen annually. In the Peoria and Pekin area, Susan G. Komen Race for the Cure is huge. Figure out a way to tie this into that. So if you're looking at maybe putting something more comprehensive on a scheduling line for breast health and then, family scheduling, start doing it at a cause. Start showing them, look at how much easier we can make your life because we support this cause, we're trying to build this, and we're trying to, provide value to you. Southampton Hospital is just another example of a group that is going out there and is crossing across a lot of different areas to get their messaging out for what they've got. So they're using public access TV, they're going to health fairs, they've got advisory committees set up on numerous different topics. And then lastly, make it convenient. So whatever you're going to do, don't make us jump through hoops to be able to participate in it. We are all attached to these. Making something where it's literally a one-click process to get enrolled or to get involved or to get that appointment scheduled. You don't need that extra landing page to say, this is our scheduling tool, go schedule. Give them a direct link, jump in and schedule. So think about that with whatever you're going to put through. Don't put all the red tape involved. And then be creative. So basic little ads are not going to do it. That womanology example we talked about earlier that Lutheran did got your attention. Instantly I read it. So figure out a way that you can mix it up a little bit to get them to look at what this new service line is that you've put together.
So just to kind of wrap this up before we get into questions. So if your hospital or health system can do a really superb job with women, you're going to have a competitive advantage. There's no doubt about that. We know that. But hopefully we've talked a lot about some new ideas today that are more innovative as a way to solve issues and not just about trying to get market share. It's about, I always like to say, extending lives, because we don't really save lives, we extend lives. That's what screenings are about. That's what a lot of this is about, right? That's our role. That's what we do. So I'm going to take you through just a quick timeline on how this is a what if you wanted to try to get this started in your organization. And it starts with phase one. It's a lot of planning, a lot of strategic planning. You got to get leadership approval. Again, like I said, if you don't get leadership approval, then just wipe away the timeline, right? There's no point. So you got to get a leader that's behind it. And they're out there. Okay, and there's a lot more women's CEOs now than we've ever had before, and they're going to be more open-minded about these things and won't say the words "I can't" or "we can't" or "I don't get it" or "we're doing that already." They have a tendency to get away from that. Task force selection, vision, goals, benchmarks, metrics, very important to put down. You still have to measure why we're doing this. It's going to be a lot of work to get this done, but to make sure it's worth our while financially as well. Hospital leadership team reviews that plan, determine the resource cost, potential ROI, board approval. So that first phase is really all the planning. And then then you involve the task force to build that continuum of care, as well as identifying who the right people could be for care coordination. And the reason why that's in phase two is because we recommend that if you do a task force, you have some outside people involved. You have some outside women, so it's not all internalized decisions. You don't have just staff making these decisions. So you can't get to phase two unless you get that buy-in. Then you bring up, you build a model, you review it, you focus group test it, and then you move on to phase three, which would be more of a full launch, where you're developing the coordinator's job description, the recruitment plan, and then your rollout once you have those people in place and well trained. And like I said, in most cases in smaller hospitals too, there's not a lot of training involved because they already do this. You're just encouraging people to do this more often and to do it in an organized fashion, especially people that have extra time. Okay? Think about how many OB nurses have extra time. Do you have any extra time sometimes? What's the number one unit in a hospital that costs more money for a health system's bottom line? OBs. Are they knowledgeable? Yeah. Are they really good at screenings and they really understand women's health, especially from adolescents through? Yeah. They're really valuable. It's all sitting right there. A lot of times they just sit around, they're waiting for another baby to come in. Okay, so there's a lot of assets you have that you can utilize in something like this. Then we get into promoting it. That's all the fun stuff we already know how to do, right? We can talk about advertising. We can get that out there and be creative, and then measure, reflect, and adjust. So, questions? Hopefully we have 10 minutes. Good. Anybody putting this into practice yet? Questions? Patty?
Question.
Yeah.
So are people paying for the opportunity to have a concierge? Or is this just an opportunity to create loyalty and actually really drive more business and help people navigate this better?
Well, like the Stanford example, they're paying. On the coast, they're paying. Mount Sinai, they're paying. You know, the Hollywood Hospital. That's going
like a
on.
retainer fee? Or
Yeah, it's
something?
a yearly fee from like $3,000 to $5,000. What I've seen, and I'm not saying you couldn't do that. Especially the Chicago hospitals can definitely apply the model, and maybe some of it's going. I just haven't found it up here yet. It hasn't hit this state yet. It should, but you're so busy up here merging all the time. You got to settle things in a little bit, but yeah, I mean, you could charge for it. But I know where your hospital is and your population, you may or may not be able to do that. Or maybe the fee is lower, but you don't necessarily have to charge for it, because really in a lot of ways you're just communicating to women and trying to help them in a way that's more proactive rather than just waiting for them to do everything. We push the messages out and we wait for people to do what they're supposed to do. We do it again and again and again, right? So that's the idea. So if you can find a way to charge for it, sometimes that's good because there's more of a value put on it, and people say, yeah, I pay for that and it's worth it, even if it's $200 a year or whatever, you know. So thank you for bringing that up. It's a good clarifying point. So, anybody else? Yeah.
I have, I guess, maybe a practical question.
Yeah.
Because I'm a wife and mom and all that stuff. So I'm kind of intrigued by this whole notion that someone can help you track things for your family then.
Right.
So in theory then, or does this really happen where, like, say, I'm like the head of my household, and then electronically there's some digital, like these are all the people that are assigned to me for them to help me track and be aware of upcoming appointments and kind of
Right.
plug it into my calendar. I mean, can it electronically pull this stuff into my calendar? And I mean, is that all part of it?
Portals are already
I-
there.
I think
Yeah.
with the portals and all of the information that's being mined at this point, there's no reason why that couldn't be in place.
Good.
Whether or not it exists, you know, that remains to be seen. But all of that information is readily there. I mean, hospitals know if you have the ability to have information released to you on your child. You know, I had to go through a whole slew of paperwork for my dad so that, you know, I would get the calls and be able to oversee stuff. So for me, I would jump on that in a heartbeat, and I would pay for it. It would be a huge value savings to me.
Yeah, talk about a way to shore up market share too, but at the same time, you know, you look at CRM, a lot of us are using it already. We're using EMR. We're filling it full of data. The thing that I'm not seeing is the correlation of the family members together to take care of the family whole. I still see a lot of individual care. Right? Oh, it's your son. Okay, we're going to focus on him, and so I think this is a broader look at it. Aaron, do you have a question?
So the model that you're proposing would be with a staff person that's like an RN type role.
Yeah,
Okay.
yeah, RN, and I think diabetes educators, people like that are that can just help with availabilities. But you gotta be careful in terms of what you can get into, and if they get into medical advice, that's the challenging part. So like you saw that one example, it's mainly nurses with a physician behind them.
So
You
the
know.
patient would still need to be their PCP.
Oh,
I'm
yeah, it's just
I'm
advice, and it's just coordination is all it is. It's not healthcare, really. Go ahead, Eric, sorry.
I was just going to say, I envision this person being so heavily leaned on that it might almost be helpful to have it be like a nurse practitioner.
Yes.
That could make some of this
FNPs would be ideal.
could make some of this
Yep.
billable and could
Yep.
kind of handle
Yep.
it instead of triaging it.
Yep. Yeah, exactly. I mean, my niece is actually here. She's staying in this hotel, but she's up doing some work on some paperwork. She's a FNP for OSF. And I wanted her to come down for this talk, but she's busy and tired from doing 12-hour shifts to be able to come and have some fun in Chicago. But she worked in neuro for like 8 years before she became an FNP. Some of these
What's an
FNPs,
FNP?
family nurse practitioner or advanced practice nurse now, but they have a lot of experience. and they're almost more grounded and almost give better advice. I hate to say it, and there's no doctors in the room, right? Than a lot of physicians do that are very channeled. And it depends, you know.
Better education.
Yeah, they're so well rounded. We all know nurses that become doctors are amazing doctors a lot of times. You know, I don't know if you guys know anybody that was a nurse. And there's a lot of great things going on right now with the people that are handling primary care. Really good things. People that are, you know, and so that's why, I mean, I don't think this idea would even could be feasible, you know, 10 years ago. Now I think there's a lot in place, you know, with the type of people that we're leaning on could be a part of something like this, where they have more of a direct connection with the families. But it would be a team, and you have to have a pretty big team to do it, you know, because if someone's on vacation, you got to have somebody there. But again, it's not so much a call center. That's different. That's inbound, you know, this is more one-to-one communication. Yeah, but you got...
It's kind of like chronic care management,
Yeah.
specific to women.
Right.
But pulling in, I love the idea of pulling in and just having a whole list. And then it can just trigger
Right.
off. Like if you develop
Grandparent,
electronic things
Yeah.
or as people hit benchmarks, okay, 6 years old, that's going to trigger some kind of an alert to whoever is the care coordinator.
And there's wellness tools that you can build in. Like there's a company up in Minneapolis that I'm familiar with because they partner with an insurance client we have. It's a big insurance agency in our own town called Benovate, and they have a health tracking tool. So you can build in health tracking to it, so you can do the reward system because there's a lot of that goes on too. You know, to try to get people to exercise, and I mean, there's a lot of different components and modules you could build in. But again, it's finding your niche. What can you introduce? Well, how you can solve problems quickly to get things, you know, the energy going, and then you can always add other components around it. You know, other ways that you could do it is building it around employers too. You know, focusing it on pods of women and different employers. Just a lot of different ways you can go about it. So. But thank you for that question. So, anybody else? Yeah.
I know, that's why I was really excited. I was like, yes, I would love to present with this because please, I'll buy it right now, you know. I'll switch and I will work with whoever. So, 'cause it's a lot.
But it's working at, you know, like I said, study Johns Hopkins, take a look at Stanford, look at some of those case studies, you know, learn what you can do even at a smaller scale. Or a larger scale. I mean, there's a lot of big systems here in Chicago that tackle this. It'll take them a while, but you know, whoever does that first is going to have a huge edge. Whoever really figures that out.
Right, there's a lot of downtime, you know.
There's a ton of downtime throughout the whole health system. There's so many people I walk through hospitals. I've done it my whole career, watching people just sit. They don't have anything to do. They're waiting for somebody else to come in. They've got to open time, but. You know, there's a way to team this, especially in the small rural setting, you know, where it would be people working on, you know, they have more than one job, and where the larger systems could designate people to just do this because you're caring for millions of lives rather than hundreds or thousands of lives. So it's you got to scale it. So. Anybody else? Cool. All right. Thank you so much for listening. Appreciate it.